Welcome to Health and Veritas. I'm Harlan Krumholtz.
And I'm Howie Foreman. We're physicians and professors at Yale University. We're trying to get closer to the truth about health and healthcare. And so today we don't have a guest. We have a great opportunity to talk about any number of topics, and there is a lot in the news right now. What's on your mind to start off with?
Well, let me just start away from the news a little bit. I went to a play last night at the Yale Rep.
I love the Yale Rep.
Yale Rep's incredible. Yeah. So there's a play there by the name of The Far Country, and it really focuses on the experience of Chinese in the United States from around the turn of the last century. As you know, in 1882, Chester Arthur signed the Chinese Exclusion Act, which was sort of the first time in America we prohibited the immigration of certain people.
I would not have even been able to tell you which president or what year, but I did know that. That's
so this play kind of takes place during a period where Teddy Roosevelt is president, and people are trying to get in from China. Actually, it turns out the people who could claim that they were born here could, be insulated from that because they're American citizens. But this takes place looking in San Francisco, and after the earthquake, many of the records were destroyed.
Right.
And so people were in difficult situations. But they follow a young man who ends up on Angel Island, which you can think about Ellis Island being where the Europeans came into the country.
Is that off of San Francisco?
It's off San Francisco, but it's a very different experience. Yeah. I mean, people were being held there for months and months and months, trying to prove why are they coming here? Do they have rights to come into the United States? And anyway, it was a remarkable play because it really portrayed the sort of difficulty, the challenges, the way in which Chinese were treated in this country. I'll just say one quick thing about it that I thought was very interesting. So people were held there for months and months and months. Many of them began writing poems on the walls. Mm. The authorities there began to cover up the paintings. They put plaster over them. They shellacked them. But over periods of time, the poems actually emerged because of the heat and the light. Yeah. This sort of they came out again, and so this play is sort of built on this sort of idea that people's identity sort of perseveres over the sort of authorities trying to push them down and make them something that they're not. So
it's amazing that for a nation that is fundamentally a nation of immigrants, notwithstanding the original sin of slavery and the basic devastation to the Native Americans, but a nation of immigrants, and we don't treat immigrants well, not at any time in our history if we were in particular.
So we're really a nation of perseverance. I mean, the people who came here persevered, and so many people despite things. Anyway, I just wanted to share that. It was a remarkable play. Anybody who hears about it, once it gets a chance to see it, they should.
That's great.
What's on your mind this week?
Yeah, so look, I've been wondering when we're going to talk about this. H5N1 bird flu, which, every time you hear about these things, and it's been for over 2 decades that we've actively talked about bird flu, you wonder, is this overhyping or what? But bird flu is currently afflicting cows in multiple states in our country right now. And I just wanted to mention a few points that I think are worth highlighting here. First of all, there's only one afflicted human being from this bird flu.
Someone conjunctivitis or something, right?
Yeah. Conjunctivitis. And the disease was otherwise completely self-limited. For now, there is zero evidence of respiratory illness in humans, and the cows, because we should worry about them too, are also not terribly affected. Most of them recover pretty quickly. There is underreporting of this disease, which should not be that surprising because farmers are accustomed to knowing that if authorities would know that your cows are infected,
they're going to kill them probably.
Either kill them or at least take them out of circulation for milking. And so they're afraid of that because that's their livelihood. And what was interesting to me is I love this TV show, All Creatures Great and Small.
Yeah.
It's
sure.
Like
it's about that vet.
Yeah, and it's like the third generation of this show. It's been on PBS.
I didn't know it was still on.
Yeah, it's a new one. And one of the episodes is about exactly this, how farmers were afraid to reveal that a cow might have tuberculosis because it would
Well,
kill the whole
the
herd.
chickens or the pigs, I mean, in China they killed millions and millions of pigs.
But this is an issue that we should come back to at some point because this is the problem with mandatory reporting or how do you
How about those minks? Remember the minks had COVID?
During COVID, right.
What was that, in Denmark or Netherlands or somewhere?
I don't want to make
I know now I'm mixing
real
it up.
problem. But it's a real issue about how do we get people to report without harming them.
Yeah.
Like in many cases, the way to handle it is hold somebody harmless, like make sure that you're made whole if something happens to your herd. But anyway, it's another point to raise. There's still too little information about this outbreak, but all indications are that it's actually pretty large and that it's spread primarily through the mammary glands or the udders of the cows.
Should we stop calling it bird flu?
Yeah, I know. Well, it's a good question. It's H5N1.
It's zoonotic at
We
this
should
point,
just
right?
say H5N1.
Yeah,
I mean, really,
yeah.
and get people acclimated to the fact that it is an influenza virus. It's H5N1.
But Howie, look, people are listening now, and should people be worried about this?
Yeah. So here's the things to worry about. The cows are a bigger and bigger reservoir, meaning that there's more and more infected cows, and the virus replicates inside the cows. The more it replicates, the more it mutates. And the more the virus mutates, the more likely that at some point it will infect another animal. And once it's already in a mammal, right, it went from the birds now to the mammals, the likelihood of it eventually leaping to humans gets greater and greater. So that's one thing.
So is the idea that they're kind of an incubator, and so that
At some point it turns
Yeah.
the wrong way. And so we do need to figure out how to get a hold on this for the cows right now. We are tracking wastewater as well, and the wastewater samples in some regions of the country are trending higher, so we think it's getting worse at this point. But we really should be tracking it. We should be testing.
But do you
for
think that wastewater is just from the cows? Is that?
That's what they're implicating at this
Yeah,
point.
yeah.
It's in farming areas, and it's in specific cities where a large number of
I
cattle
just wondered
are.
if people could be asymptomatically infected.
So we don't have evidence of that yet. We do have tests, so there are ways to test for it, and there's no evidence of asymptomatic tests. But it is
Asymptomatic positive test.
correct.
Yeah,
Yes,
yeah.
sorry, but it is an issue that it is in the udders. It is an issue that it is the mammary glands of these cows, because what they have started to find is that the virus particles are showing up in pasteurized milk. Now, it is not the full virus, not a living virus, not a culturable virus in the pasteurized
You
milk.
mean milk that we could be buying in the store right now has these viral fragments?
Correct.
Interesting.
Right. And so that's where people are starting to get concerned. Now, there's still no evidence of anybody having any ill effects from that. And as you know, pasteurization is a highly, highly effective process to remove infectious particles from our milk. And it makes it easy, possible for us to eat and healthy for us to eat or drink, rather. And by the way, it's also cheese, so it is eating. But in this case, we are seeing the particles. And so this brings me to the next topic, and you can guess what this is what about unpasteurized milk?
Yeah. Well, many people drink unpasteurized milk.
So I have never known anybody who had unpasteurized
Actually,
milk.
I think you can buy it at Bishop's Orchard in Guilford. I think I've seen it.
It's possible. I don't know. It's legal.
Yeah.
It is legal. I don't know if it's possible.
I mean, people like it because they think it's the freshest possible milk, I think. And this isn't to say anything bad about my very favorite grocery store in Guilford.
It's true, Bishop's Orchard. So here's what I know. I mean, I spent time looking at this. What drew me into this is, like, randomly I came across, I think, a TikTok or a reel on Facebook where somebody is saying, if you're having irritable bowel symptoms, the problem is you've got to get rid of processed food and you got to start drinking raw milk. Raw milk, which is the unpasteurized milk straight from the cow. So I started looking into this, and there's this tiny, tiny bit of information about raw milk that suggests it has benefits. It seems like most of the benefits line up with farm living. And so it's hard to know, is it the milk or is it other things related to farm living that have made these people have a lower
Do
incidence?
you drink milk?
Very little. Cheese mostly. Almost no milk.
Because
Eczema.
milk's kind of they had that whole campaign about you got milk,
Yeah.
I know we're
Right.
not talking, I'm just talking about milk in general.
No, yeah.
But, there were a lot of people that were raising the thing, maybe it's not that much of a health product, honestly, that was really all about a campaign that people should be drinking milk. But really, when you look at
We've got a big dairy industry in this country.
the
It would
sugar
not
and
surprise
like
me.
it's not necessarily the healthiest beverage.
So, but to the raw milk thing, like, I started looking into this because I started.
And I don't want hate
thinking-
milk from the dairy industry. I'm just saying, but
No.
I'm just saying what I've
exactly.
heard.
No, it's interesting, but it turns out raw milk is prohibited by the FDA. So the FDA prohibits raw milk, but as we've talked about before, they can only prohibit it insofar as interstate commerce.
Wait, I'm confused. What's the difference between raw milk and unpasteurized milk?
Same thing.
Okay.
Same thing. There are
The FDA prohibits it, but people sell it.
Correct, because the FDA prohibits interstate sale.
I see.
So you can't cross state lines. You can't,
Because that's where their jurisdiction is.
correct. It's from the Commerce Clause.
So a
is where-
state would have to say that they were against
correct.
it.
And so you look at the map.
That is wild.
Exactly. So you look at the map. There are a few states that absolutely prohibit it.
Wait a minute. So the federal government says, we are prohibiting
Interstate
unpasteurized
sale.
milk. We think it's so bad that we don't think if you live a mile on one side of a border, you couldn't take it on the other side of the border.
Correct.
But within that border,
You can do whatever you
Godspeed.
want. Same thing with compounding pharmacies, and same thing with the spas. This is where is the limit of the regulation. So the states do have control of this. State of Connecticut says that you can sell this from a farm, I think. I forget if you're allowed to sell it to a retail store.
And I may have been wrong about Bishop's, but I have
Yeah.
seen it on some shelf in some
And you're
grocery.
correct that in Connecticut it is legal to sell. I just forget there's various
Yeah.
versions of it about whether you're able to sell it to a retail store or whether you have to sell it from a farm. But the various states all look like that.
That's
Everybody's
interesting.
different. So
And what does the FDA say? Why do they give a justification?
yeah, because we have these enormous numbers of outbreaks from E. coli and salmonella involving raw milk and
You know
raw-
that
and
Louis
sh-
Pasteur, he was a clever guy. You
I know. We ought to give him his due. And so it's insane. But I was looking. So we've had in just like a 15.
He's one of my favorites, by the way, Louis Pasteur. He made major contributions.
I think I wrote a paper about him in first or second grade. My father probably still has it, or my mother does. E. coli in 4 states involving 10 people, including 4 hospitalizations and 1 person with hemolytic uremic syndrome reported 2 months ago.
Wow.
That's just
Wow.
recently. And there are hundreds of cases that are directly related to raw milk. Now remember, raw milk is a relatively small industry, but it is fast growing. And so right now, the bottom line for all of our listeners is no raw milk, not right now. Even if you are willing to take all the other risks, we don't know enough about H5N1 coming from the cows. Just cut it out of your diet until we learn more.
Okay, I'm going to go on record saying right now I'm not that worried about H5N1, but I just wonder if I'll be shown wrong. I mean, a lot of things have to happen for this to actually be a threat to humans.
I agree.
And it doesn't even look like it's a big threat to cows right now.
Correct. But so here's the weird part of it is the cows are presumably getting it when they're being milked.
Yeah, right.
They're not getting it by eating anything.
Right, so I even wonder if it's got a tropism for the udders or whether it's just about the skin and, these things are being transmitted because of...
because it's coming from the udders now,
Yeah.
the concentration of H5N1 in the milk is apparently like off the charts.
But couldn't we just start monitoring for this? I mean...
We should be.
Yeah.
I mean, this is part of the thing we
But this
learned.
was the thing. The pasteurization is thought to inactivate the virus,
Everything.
even if there's some remnants.
Correct.
Right, so...
Highly effective at it. It seems there are no culturable viral particles.
So let me say the
found
reason
yet.
why, to support why I said that I'm not that worried yet. I'm going to be worried when I hear that there's airborne transmission.
Oh, yeah.
Yeah, but I'm just saying, in the absence of the airborne transmission, it seems like this is actually somehow surface to surface to the udders.
So I agree with you, but like the conjunctivitis case, by the way, you know how we think it was transmitted?
How?
Because the person was milking the cow and it squirted in the eye. It's such high concentration
Yeah.
that even an organ that isn't usually infected by a respiratory virus got infected because it's in such a high concentration. So I would just, the only
Yeah.
reason I'm saying caution, I'm not saying like people should run around with their head cut off. I'm just saying.
You're a cautious guy.
I'm a
think.
cautious guy.
Yeah, I know. So, and I'm not being concerned, but I got so many other things to worry about in this world right now.
I hear ya.
I'm putting it on the side until
I know.
until it's more actionable for. Let me get on to another thing
Yeah,
now I
let's
wanted
do
to
it.
talk to you about. So, you remember telehealth?
Yes.
That was an exciting era, right?
It's over.
That was. Well, wait a minute. It was gonna change everything forever, forever, right? I mean, seriously, it was like the pandemic accelerated our movement towards being able to implement a system that was going to be much more convenient for patients. We're going to be able to
And
do.
it is very active, and we are using it a lot more. It's
So-
not like it's gone away. It's just the industry.
So
is
it's
sort
just
of
so
important.
interesting, So this teledoc, which I've been watching very closely, you know that they sort of got rid of their CEO with an abrupt departure. This guy had been there for 15 years. He grew the company from practically nothing. A guy by the name of Jason Gorvich, and then they basically were going in a different direction. Right now, they actually have an acting CEO. I mean, it wasn't like they
They
had
weren't ready for a search.
No, they weren't.
Yeah.
No, They didn't make a transition.
Right.
They basically said, thanks very much for 15 years of service.
Goodbye.
And, I'm sure he's done very well, but, and they want to say, tremendous legacy and blah, blah, blah. But, they're having trouble. Their stock's down 40% year to date. And there's a lot of questions about the overall performance. Just for, to remind, the stock's at about $13 today.
What was its highest? Do you remember?
About 300.
Yeah,
about 300.
Just incredible.
Yeah. So their market cap now is about $2 billion. And that's nothing to sniff at. I mean, you build a company $2 billion, that's a success. But it was a lot higher.
$50 billion or something.
And
right?
you know how I rail about this Livongo acquisition.
Yeah.
I just have to
You taught
say
me
it
about
again.
that, yeah.
Livongo was a company that was basically had outpatient chronic care services for people with diabetes, and they were going into people with hypertension. And they had created a continuous glucose monitor, which I thought was a little clunky. And they had revenues of about $245 million. Nothing, that's good. They were losing $45 million a year. So, $45 million a year. Livongo, Teladoc bought Livongo for
It's like $15 billion or something.
$18 billion. $18 billion. They've already written off a lot of that. And that was in the heyday, when their stock was so high.
Right.
Some of it was stock, but some was straight out cash. Everyone in Livongo, I think, did really well. But, just nuts. So currently, Teladoc brings in about, $600 million in revenue. They had also bought this mental health group, Better Health. So it's all about like all telemedicine stuff. But, they're having a little bit of trouble. Their net loss is in the first quarter went up to $82 million, and their EBITDA, is 60 increased 20%, 63 million. So they got cash flow coming in, but there's a lot of concerns about the company. Of course, the company's saying, "Don't worry, things are great," but it's just so fascinating to me that this juggernaut of telehealth, and then you may have read it also, Optum discontinued their telehealth. Did you see that, Howie? I mean,
I did not see that. You mentioned that you were going to talk about telehealth, and I honestly should have looked that up. I did not.
No. So they had a thing called Optum Virtual Care. So Optum, which is an arm of United Healthcare, it's throwing tons of money into reforming health. How does Optum, which has large-scale clinics and is they are taking care of patients, let alone selling services to others.
Yeah.
Fascinating. They discontinued their telehealth company.
I mean, the market's being tremendously disrupted right now. I mean, when you look out there, Walgreens shut down their primary care practices, right? Or shut down what was it called? Village MD.
Yep.
I mean, the market.
Well, I'm going to talk about that next.
Okay. I mean, the market's being disrupted right now. And what you said before is worth hearing for our listeners a little more. When you have an inflated stock price, you can make everything look great because I can buy your company for $14 billion with paper. I'm using my stock that's inflated to buy something. It makes it look great. Everybody looks richer. On the back end, it goes the other way.
So, I sometimes tell you this, riddle me this, Howie. Like, this is one thing I don't understand. So at the same time that telehealth is sort of imploding, like you said, it's still going. I mean, it's growing, but it's not like transforming medicine like it was, and the capital's not quite, where.
And it may turn out to be something that are just built into health systems.
So meanwhile, try to get an appointment here at Yale. I think I told you I needed an eye appointment, and I called up. It wasn't urgent, but I would like to be seen. And they said, "Okay, we'll see you next January or February." I just want to remind you, it's May. It's the beginning of May. And you that's true in cardiology. You know this in radiology. You need an elective MRI. How long have you got to wait?
I think it depends on what type, but it could be as many as several months.
My wife was getting her routine colonoscopy. She's been good. That's what the recommendation is. She wants to stay with the guidelines. 8 months, 6 to 8 months to get a colonoscopy. Here we want the population to be caught up, but we're making it difficult. So some of these things are procedures, MRIs and these such and such. But like take cardiology, where it'll take 6 months to get an appointment. Why aren't we ramping up at least to be able to filter who really needs to be seen in person, who doesn't need to be seen?
I couldn't agree with you more, and I wish I could explain why we're not able to fill this void faster. I mean,
And how does the hospital lose, say they're on track to lose $300 million a year, and a lot of high margin things that they do, you can't get done because, I mean,
so there, I think the problem is that we are, like, when you see the hierarchy of where we put resources, we can't tell the ER to schedule people for 6 months. And we can't tell patients on the inpatient floor that you can't get an MRI if you need an MRI. So there are certain patients that automatically jump the queue because of the acuity of their problem.
So, and I know I'm pivoting to this topic about, so I was talking about telehealth, but now I'm just talking about supply and demand, just even to see patients. So like the need for another system is there. And then what I don't get is, you're all about incentives. You teach a class,
Yep.
everything in healthcare is about the incentives. MRIs are good business.
Oh my God. And for the hospital right now, the margins they make on MRIs and CTs, and for that matter, breast imaging, are very, very high.
But wouldn't that lead you to try to figure out a system where you could accommodate all the demand?
So for us, we're in a unique situation where CON, Certificate of Needs, significantly limit our ability to do it. If those particular procedures are not particularly limited by physicians. The breast imaging may be a little bit, but certainly not the CTs or the MRIs.
So the state holds us back.
The state holds us back. We're constantly applying for and then having to negotiate around certificates of
But
need.
I am hearing this around the country. A lot of other people are having this same problem. I mean, it's not just a Connecticut problem.
Yeah, no, there's access problems all across the board. We want to hire people, like across the board.
We do. We're hiring docs.
I mean, I think we're hiring docs in cardiology as well.
We're trying, yeah.
So I do think we're trying our best. I do think the hospital is filled to the gills, and that ties up capacity, and it hurts our ability to make money because, quite frankly, our ER and inpatient are where we're going to lose money.
But it just, and I want to pivot to, I know you got a couple of things you want to talk about, but I'm just saying, is the market failing? Because we often like to say, we know we've got problems with our healthcare system, but some people like to say, but you don't want to move away from our capitalist system because the market in the end is highly efficient. We know that this isn't a real market in healthcare, but they say the market will respond, private equity's coming in, all these things, and yet somehow the demand for services is not being met.
We definitely have a lot of regulations, many of which make good sense.
So you're attributing it to regulations?
I think some of it is. It's not just the CONs, by the way, but some of it is. Like, wouldn't it be so much better if doctors could figure out how to see patients according to their need and not according to, like, how do I code for the maximum amount of money?
Well, that's another crazy thing.
But that's part of it.
How about why do we have any limits on the number of doctors? We have many more qualified people who want to be doctors than we're allowed to be doctors.
Practitioners.
Yeah.
And I mean, we absolutely constrain nurse practitioners. There's a lot of turf battles between physicians and other practitioners. We could do so much better. We allow regulation to get in our own way.
All right, hey, come on, get to your next topic.
Yeah, so this is a quickie. But so you and I have talked about this a lot. Like, both of us are still on Twitter, X, and both of us sort of have a love-hate relationship with it.
I may expand now that I'm editor of a journal, I feel now an obligation. I actually may dig into this a little bit more after being away from it for a while.
But I right away, as soon as I was offered the option to participate in community notes for Twitter, I got involved in that. So I got involved.
What's community notes?
Yeah, so you can create a note on almost any tweet and say, this is complete fabrication. This is ridiculous. It's stupid. Here's these 4 papers that prove that what you're saying here is absolutely wrong.
And how do you see that on X? Like, so, okay, I've just tweeted something you disagree with.
Exactly.
And then you write a note to say what I've written is no good.
Exactly.
Where does it appear?
Notes, it doesn't appear until a group of other members of the community notes
validate that.
Validate it. And they fight over it, Harlan. And there's been times where I've been enormously
But do they have to vote for you?
Effectively. So I've been enormously skeptical of this because I'll go on community notes. I see it. You won't, but I see it. And literally someone will say, blah, blah, blah. And then the next note will say, the person above wrote this. This is absolutely wrong. And then the person below that says, NNN, meaning no note needed. You guys should be arguing this. You guys should be arguing this in the replies. This is not appropriate for community notes. And everybody's being rated constantly in real time as to how credible they are. And you'll occasionally get...
But what if you attract a bunch of, for example, extremists in one direction or the other? Then they're all kind of endorsing each other, and it's making it seem like there's voting for it.
So that's what I was worried about. And that's what this paper made me feel a little better about. So this paper comes out, written by a medical student at University of San Diego, who looked at COVID community notes around COVID-19 vaccination misinformation. And I thought for sure he was going to say there's been like no impact. But the overall summary, I'll read you the summary statement. A sample of community notes added to posts on X containing COVID-19 vaccination misinformation primarily addressed adverse events and conspiracy theories, were accurate, cited moderate and high credibility sources, and were attached to posts viewed hundreds of millions of times. And so that's when it gets visible. At a certain point, you get enough effective votes from credible people that it becomes visible.
Well, what's a credible person? Someone with a blue check?
No, somebody who's gotten enough.
Who's been endorsed by the community.
Exactly. And you don't, like, nobody knows it's me.
Has this worked for you? Like you've gone on, put community notes.
And then I get a feedback sometimes a day later, sometimes a week later, that'll say, a community note that you effectively endorsed has now become visible to the public. Thank you. Your score has gone up.
And then when I see the original tweet, will I see your note?
Not at all. You'll see my note, but never my name.
Never, not your name.
Right. So if I get a note on there, you'll never know it was me that wrote it.
That's fascinating.
It is fascinating. And this.
So you're a creator now?
I'm a moderator, I would say. I mean, I don't know.
But you're creating notes.
I'm helping. Yeah.
Uh-huh.
I'll rate notes and I create notes. I create very few. I mostly.
How many hours do you spend on this a week?
Maybe an hour. Not more than that.
That's good. Yeah.
But the point is, like, JAMA, I forget if it was Network Open or the main JAMA journal, had this nice piece, and it gave me hope that maybe there are ways to moderate misinformation. Bottom line, they also said more social media firms should open source their misinformation countermeasures for evaluation by independent scientists to illuminate, foster public trust in, and scale the most effective strategies.
I'm just worried that the loudest voices win, or
that's what I was worried about. But that does not seem
so
to be the
far.
case.
It's not be the case.
Right.
It's fascinating. Hey, the one other thing I wanted to talk about today was the news that came out a couple days before this releases, is that Walmart was shutting down their retail health.
It's crazy.
And
they were one of the biggest players.
So this is wild. You know, Walmart, I was so excited about this because Walmart is, within 10 miles of 90% of the population, and they really do serve so many different, people in society. They're known brand as value, and many people, how do they afford school supplies? How do they afford clothes for their kids? It's because they go to Walmart. So, it's a trusted place for them. And so they started this initiative where they said, we're going to start building primary care clinics. And they made, big commitment. They launched it in 2019. They expanded to 51 facilities in 5 states, but they were talking about, having another 75 by the end of this year. Just a few weeks ago, they were telling people about, we're having a little bit of trouble with some construction, but we're still on track to be able to do 75 more this year.
These are mostly in-store clinics, right?
Yeah.
Yeah.
Well, they could be standalones or next to the stores.
They're
right. Brick and mortar.
Yep.
And, they were intended to be able to provide this kind of primary care. And, wow, they've completely discontinued the program. Now, this comes on the heels of a lot of other retailers struggling with primary care businesses. This seemed like a good place to go. You may know Walgreens is scaling back its footprint. You mentioned before the Village MD. They're shuttering 160 of the Village MDs. This is interesting that, Walgreens in March of 24 announced that they had lost $6 billion in the second quarter of 2024. They had an impairment charge of $12 billion. You want to tell the folks about impairment charges?
Yeah, it's just when you realize that something's never going to be valued at what you thought it was, and you just take a hit to your earnings all at once.
So they had taken on Village MD with about a $5.2 billion investment, and then they took on this. You know about this Summit Health City MD? It's another group providing care. They invest $8.9 billion in that, and now they seemingly are pulling back, and this is a big deal, and so CVS also and Amazon have been, expanding their reach in this area. And the question's sort of going to be, how's that all going to be going? Amazon bought One Medical.
One Medical is different though, right? So One Medical goes after rich people.
So exactly. Maybe it's a little different approach. It's got the sort of high-tech approach. Remember, Amazon shuttered. They had another group that was trying to do the primary care. They shut down. CVS picked up this Oak Street Health, which was more focused on seniors, Medicare.
Advantage, right.
They bought that for $10.6 billion, and it's going to really be interesting to see what happens there. They also bought this company in 2023, Signify Health, that was focusing on health and technology around care delivery. I don't know. Somebody said to me yesterday, well, maybe Walmart found out it's harder to take care of people than to sell lawn furniture.
We had a former president who said healthcare is hard.
Well, I can tell you, Walmart's not naive about this. I mean, you may know that they've got 4,600 pharmacies and 3,000 vision centers, and they're a pretty smart group of people in that company.
And they've been planning and doing this for like over 15 years.
So I don't think it's a naive group that went in and said they didn't know what they were doing. I don't know exactly what triggered it, but here's the thing, and this is finish up with what we were talking about before. Try to get a primary care doc in New Haven County right now, or in most places around the country. So I had hoped maybe this would decompress this, and also for kids. It's like a lot of these kids up in the emergency department because simply parents can't find primary care for their kids. And so, we're going to have to think about other approaches. But, the retailers seem like it could work, but maybe, always primary care is a lost leader, and the only way it works for the health systems is because it feeds other things. Because we've got this crazy system of reimbursement.
Oh, it's insane. And look, I am reminded, though, that for the lowest income individuals, those that are on Medicaid or even uninsured, our federally qualified community health centers are the absolute best safety net around because they have primary care providers.
And they've been great, but they're also in many places are overwhelmed too. I brought up this issue about, I had trouble, making appointments. Imagine somebody with very poor insurance or uninsured,
it's impossible.
with no facility to navigate the system. We've got a problem. But the primary care issue is a crisis. And them withdrawing just also says that okay, this is not going to be the solution.
There's been an awful lot of areas where people have moved into healthcare thinking that they're going to make a mint, and then they move out. And I think it is what you said. It's a lot harder than it looks.
But they said they were far from profitability. They really just started a couple of years ago. I would have thought they would have had a 10-year time frame to when this thing can really be profitable.
Businesses map things out and figure out not only when we'll be profitable, but if we'll be profitable. They may have figured out that it's an if, not a when.
And they have other places to put their capital to get returns for the company. Yep. Maybe that was what it was.
Yep.
So this is great, Howie. I love talking to you. What a great session. I love the guests we have, but let me just say these are great sessions for me.
I'm really glad that we get to do this. And we have, as we're going to mention in just a second, we got the live session at the Innovation Summit coming up. So we've got a lot of fun.
That'll be something different for us.
Yeah, that'll be great.
Yep.
Different environment, totally.
Yep. So you've been listening to Health in Veritas with Harlan Krumholtz and Howie Foreman.
So how'd we do? To give us your feedback, or keep the conversation going, email us at health.veritas@yale.edu or follow us on LinkedIn, Threads, or Twitter.
And we very much want to hear your feedback, or, if you have questions or any suggestions for us. And if you like the podcast, please rate and review us on your favorite app because that helps people find us.
Absolutely. And we love seeing anything anybody has to tell us. And if you have questions about the MBA for Executives program at the Yale School of Management, reach out via email or look to our website at som.yale.edu/EMBA. And as I mentioned, we're going to be doing this live in just 4 weeks at the Yale Innovation Summit on May 30th.
Who knows what we'll say?
I know, and we got 3 guests. We have never met them before. We don't even know who they are in advance. It'll be fun. And the links are in the show notes today. Come to the Innovation Summit. See us interview some of the greatest health and technology innovators.
All right. Health in Veritas is produced at the Yale School of Management and the Yale School of Public Health. Thanks to our researchers, Ines Gil and Sophia Stumpf, and to our producer, Miranda Schaefer. Amazing people. We so appreciate all their help.
They always roll with the changes. We really appreciate them a lot.
They're great. Talk to you soon, Howie.
Thanks, Harlan. Talk to you soon.